So that's my little bit done. I'd now like to introduce a well-known individual to the industry, Mike Ward from Clarivate, who's going to do his Winners and Losers 2021 session. Mike.
Yeah, thanks very much, John. Other words, epidemiology. I mean, crikey, who knew what that meant until this. So it was one of my favourite words. So this is, we've been doing this for many, many years now, so winners and losers. Last year it was kind of a little bit more, it was a bit hard because it was a bit hard to sort of talk about losers. But this year I'm back to sort of picking on some individuals, which I hope you'll enjoy. So just as a sort of a caveat, while sort of the data has been sort of, acquired from sources at Clarivate, plus some other places, everything I'm doing here, it's my fault. So it's nothing to do with Clarivate. So I am taking full responsibility for it. I also thought I'd sort of put a bit of culture into my presentation. It's about time. And this is just essentially, if you think about it, when you've got winners and losers, it tends to be that they run it's sort of in tandem, and it's actually from what perspective, whether it's actually what you've seen is a good result or a bad result. So I thought that this sort of rather sort of cognitive response is this was effectively me over the last few days to try to work out what I was going to put on these slides. So this here, as you can probably all sort of gather, is essentially what has happened to COVID over the last 2 years, and you can sort of see the ups and downs. You can sort of see that actually the sort of the deaths in all the regions at the moment. Europe is in a sort of a pretty bad place with the sort of the number of cases, etc. But we've had 265 million people have been affected by COVID-19, and unfortunately 5.2 million people have died. Now clearly that would have been much worse if it wasn't for the efforts of these people. So the sort of first set of winners, are clearly, Pfizer and BioNTech, Johnson & Johnson, AstraZeneca, the University of Oxford, Moderna. Who's not been quite so successful is COVAX. These are the guys who are trying to get COVID vaccines into the sort of the less wealthy nations of the world. And although they were hoping to be able to provide 2 billion by the end of the year, unfortunately they're only going to be able to provide 1.4 billion. That's not for want of trying from those individuals, but clearly there are lessons I think that world governments can learn from this experience, and particularly with the sort of Omicron coming out of South Africa. There has to be a kind of a link between the fact that in Africa you've only got 11% of people that have been vaccinated. So that's a lesson to be learned. But of course, those guys, they wouldn't have been able to do it without these superstars, Kate Bingham and Anthony Fauci. Also, the fact is that these guys have made science look cool, and unfortunately been a very, very calm and neutral voice in the whole sort of development. So therefore, in spite of what the politicians are saying around them, they actually managed to pursue what was required. And the fact that it's sort of I think yesterday was the anniversary of the first vaccine going into a human being. at the speed that they did it, that it's a lot down to them. So we've got a lot to be thankful for. So, although the sort of the pharmaceutical industry, in 2021 and for summer 2020 was seen as like the good guys, it doesn't mean that they're going to have everything their own way. So, just a couple of weeks ago, we saw the social spending and climate bill, Build Back Better or something that I think it's called. This is Nancy Pelosi. The only thing where you saw in the States where there was a consensus or a bipartisan consensus was actually around the fact they had to do something about drug pricing. And in this bill, there are some components which are going to be challenging, certainly in the next year or so for pharmaceutical companies, because of the way that Medicare will be allowed to actually negotiate. And interestingly, if a pharmaceutical company says that they're not going to negotiate, then they get hit with the 95% tariff. So, effectively, it's like, negotiating with a guy who's got a gun against your head. But interestingly, there was a number, that's from the budget office, that 128 billion it's going to save the federal drug spending over the next 10 years. That 128 billion is obviously coming out of the pockets of pharmaceutical companies, but actually overall, over that period of time, it's a small percentage, and the trade-off is, in fact, that they will retain the power to set prices for new drugs, etc. So it's not all bad news. But also we see that the world's second biggest market, mainland China, is also introducing a lot of drug pricing cuts. So you can sort of see here the discounts that companies are having to provide to be able to get on the reimbursement list, the NRDL. So it's a pretty tough place. So, in many respects, the pharmaceutical industry has kind of lost out a bit because the politicians are just kind of pushing, and of course they're all sort of like struggling with the fact of all the money that they spent having not prepared for a pandemic in the first place. Interestingly also that the actual the public markets haven't supported the industry or recognised the efforts of the pharmaceutical, the biotech and pharmaceutical companies. So you can sort of see here that actually they've gone down. So the Nasdaq Biotech Index slipped 2.4%. Pharma Index is down 10.7% this year. Although the composite, which is everything, the techs, etc., the Nasdaq is down almost like 22%. So it's been a pretty tough year. The interesting one is the healthcare index. So this is actually the hospital systems, etc. This is very much associated with what's going in the US. But you can actually sort of see that healthcare, which isn't biopharma or biotech, has done pretty well. But the sort of ETF biotech funds, they've actually gone down pretty bad. Nevertheless, there's still plenty of money. So this year we've seen a record amount of money going into the sector in initial public offerings. So we've got there Oxford Nanopore, which was from around these parts. They raised a sort of huge amount of money, and that was in fact on the London Stock Exchange, and it was like the first full listing on the London Stock Exchange by a biotech company since Circassia 4 or 5 years ago. So that was actually big news, given the fact that the choice for most biotech companies is to actually list in the US. But we can see, you know, the big one here is that's the South Koreans. We've got some other sort of, you know, UK ones, some Chinese ones, a bunch of US ones. There's a big one. I'm not sure if it's closed yet, but Beijing is looking to do a 3.5 billion offering. So that's obviously going to dwarf any of this stuff. But this year, it's a huge amount of money has been raised. Sort of 24 billion dollars have been raised. And last year was the previous record, so it's all looking pretty good. And then similarly, in VC and private fundraisings, so this is the list of, you know, some of the biggest rounds this year. And again, you can sort of see, you know, China, Massachusetts, San Francisco. We've got Sweden, Accenture there, Oxford. So actually, it looks like, oh, crikey, the UK is not doing that well. But actually, the UK, as John kind of mentioned, that, you know, a lot of money's been gone in. This again is a sort of a record year. By the third quarter, it had raised as much money as the previous annual record. So Steve Bates is quite happy, and, you know, he's going to be you know, celebrating by the end of the year for the amount of money that's been invested in the sector. So that there's a lot of money going into VCs, from VCs, etc. And we've seen a lot of money actually being raised by venture capitalists to put that money to work in this space. So this is the sort of almost like the halo associated with what we've seen with the sort of the industry's response to COVID-19. What's been not as successful is the follow-on offering. So it looks like, you know, people are prepared to go into the IPOs or go into the VCs, but we're sort of seeing there's been a big drop-off. I mean, last year there was something like 50 billion in follow-on offerings. This year it's down to about 25 billion. So there isn't quite the same appetite for the follow-ons as there has been in the past. Okay, so losers. So anybody who'd sort of seen this presentation a few years ago, I had Martin Shkreli. He's the guy who called himself Farmer Bro. He spent a load of money on a Wu-Tang Clan album. It was the only one that was available, but in fact he had to sell it recently because he had to do a massive settlement. He was the guy with his company called Turing Pharmaceuticals, kind of, you know, ripped people off, but also did a massive 4,000% hike. He's currently serving 7 years. He's due out in 2023. He's actually still owns 44% of Viera, and he's actually still able to actually run the company from his jail cell, which is, you know, kind of interesting. It's obviously got internet access. But in the last couple of weeks, there's in fact been a deal where Viera is going to be paying 40 million. His pal, who was like currently the CEO of Viera, has been banned from working in the pharmaceutical industry for 7 years, and Shkreli is due to go on trial sometime this month, actually for his role in the sort of the Daraprim scheme. So 7 years, but he might get a bit more time. I'm not sure if that's actually his mugshot from the thing, but anyway. And of course, then this person here is Elizabeth Holmes. I mean, this just sounds like the script of, you know, one of those sort of, you know, thrillers. She was the founder and CEO of Theranos, which is a blood testing company, and it was fantastic results, etc. Able to raise loads and loads of money, giving, sort of selling it to the American armed forces, etc., and none of it worked. It was all smoke and mirrors. So at the moment, she's actually, you know, all the US papers, sort of New York Times, the Wall Street Journal, etc., they're all over this because this is kind of like a celebrity a trial that's going on at the moment. And she's facing 11 counts of fraud, so 20 years in prison. Now that's a hell of a loss, isn't it? So those are my first two losers. My next two losers. This guy here, Plasmodium falciparum, the parasite that is responsible for malaria. So earlier, recently, WHO recommended Mosquirix, which is a vaccine that's been developed by GSK to treat and prevent malaria. And it's shown to be really, really effective. So everybody's really, really excited about it. It's expected to prevent 4.3 million cases, avert 22,000 deaths per year. And interestingly, there are new generation vaccines on the way, including mRNA. So, for example, guys at BioNTech are actually looking at developing an mRNA vaccine against this parasite. This parasite. So it's just a coincidence that they're here. But anyway, we all know who he is. And, I mean, he lost everything. So, goes without saying. So, anyway, winners. So, I think these two individuals, they've written a book about how they sort of pulled together the Oxford AstraZeneca vaccine, recommended by Clive Cookson. So it could end up being in the FT, so it could end up being a bestseller. But I think what's really, really important is with Kate Bingham and these two guys, fantastic role models, especially for young women, to get into science and to actually really, really make a fantastic contribution. So they are also my winners. So thank you for listening. Any questions? No. Tony.
Mike, I'll ask one then.
Yeah, go on then.
So, I mean, it would have come along after you're cut off to be winners, potentially. But the sort of SPAC deal with Benevolent this week, showing the AI sort of stuff, SPACs were really hot news, probably the first part of the year, but died off in terms of news flow. What do you see the future of that in terms of
what,
winners
SPACs?
and losers? Yeah.
I think SPACs are an interesting financial vehicle to make some people very, very rich, but not necessarily the people who then get reversed into the SPAC. Okay?
And in terms of that, is this the first we're seeing of big deals with the AI coming?
Oh,
more
so
money?
so I didn't actually, because of the next panel, I actually didn't look at sort of like deals, because it would be sort of awkward if I sort of put stuff up that they then disagreed with. So I didn't want to look too stupid early in the day, or not as stupid as I would normally look. So AI, we're seeing a lot of sort of your interest in artificial intelligence. It's going to be used anyway. But it's a tool. It's not a modality that's. It's a bit like having a sort of Microsoft or whatever. I think that's eventually how it's going to be. So I think that all companies will be using some form of AI. So therefore, I don't think it's that much of a surprise. I think the interesting thing will be is those companies that were established to do AI in pharmaceuticals might find themselves overtaken once you get the likes of, sort of Novartis, AstraZeneca, etc., really sort of embedding that technology into their own systems. Then it's just like, well, it's a bit like what happened with the combinatorial chemistry companies. Once everybody could do it, there was no point in spending a lot of money when you could actually do it in-house. Okay? Martin.
Great job as always, Mike. There goes the gong, unfortunately, but there you go.
Again.
Yeah. Quick question about the cell and gene advanced therapy market and where you see that. Is it flatlining? Is it progressing? Where is it?
Okay. No. It's probably one of the most exciting places. So we're seeing a lot of activity. So, for example, early next year, January, around about JP Morgan time, Clarivate will be launching a report, which is drugs to watch in 2022. I've got to remember which year we're in now. It's been a time lord. Sometimes gets in the way. But 2022, the drugs, and these are molecules that we expect to get approved in 2022 that will have some sort of blockbuster status in 5 years' time. But we also thought it'd be interesting to look at some of the technologies that also are likely to be making a significant difference in 5 years' time. And one of those is sort of cell gene. And in fact, I think it was Gottlieb last year or whatever, he reckons that something like 50% of all new drugs that are going to get approved by the FDA will in fact be in the cell gene therapy space. So you're in a good place. Okay, I'm going to sort of hand over now.
I've got a...
All right, sorry.
Just an adjunct to that. Do you agree that the cell and gene therapy is at a cusp, because the move to allogeneic cell therapy will make a significant difference to the cost and the availability and the utilization?
The answer is yes, because again there are some challenges, but they're being resolved, and we've seen it also with gene therapy. But again, you can sort of see that there've been some sort of setbacks or whatever. But actually, there's been a lot of advances, and the fact that you're seeing that big pharma still putting money into sort of the gene therapy space, it looks pretty exciting. And also, I was reading somewhere that gene therapy for not just the rare diseases, but actually even sort of your more sort of conventional diseases might be the way. There are obviously still challenges around running clinical trials with gene therapy, and those need to be resolved. But I think the future looks promising. So I'm now going to hand over to my friend and former colleague, Eleanor Malone. So Eleanor is the managing editor for Europe, for commercial stuff. So script, pink sheets, in vivo. So she's the boss. I had a great pleasure sort of working with Ellie for 10 years. So Ellie is going to be doing the next panel, which is all about sort of where's deal making trends going. So Ellie, over to you.